Good morning. Bill Patten, CEO, Holy Cross Medical Center. And this morning I want to give you a report of the board meeting from March 31st. This was a regular monthly board meeting. During its consent agenda, the board reviewed documents from our LifeWings Quality and Safety Program, the monthly report, as well as our compliance program. These are activities that the board monitors on a regular basis. We try and have quality and safety be on par with finance, the oversight that the board does for finance. So the reports that the board saw and approved were part of that new emphasis on these other programs. The board did spend time looking at the finances from February. I would encourage you to find Steve Rosenboom's video on finance. Just a little teaser. The numbers are okay for the month of February, but watch Steve's report to get a full understanding of where Holy Cross stands financially. Some really good news out of the board meeting yesterday. The board has approved the purchase of a new mammography machine for Holy Cross. As you may know, we have had what is called 3D mammography for many years. That is no longer considered to be state-of-the-art. So we are investing significant money, $450,000, to upgrade our mammography unit. We're buying a brand called Hologics. This is truly state-of-the-art. No one in the state will have a better unit than we will have. We'll provide additional information to you about the specifics of this, but I'm really proud of the board, their willingness to make an investment of this type for our organization, for our community. So look for more information. We're getting a new mammo machine, state-of-the-art technology here at Holy Cross. The board reviewed and approved a number of contracts with our medical staff. As you may know, any contract with a member of the medical staff has to be reviewed by the board. They review it to make sure that legal counsel has actually updated it. They review it to make sure that the numbers that we're paying are competitive. These are requirements that are imposed on boards by the federal government. And so last night we reviewed new contracts for our hospitalist team, 4 doctors. We also reviewed medical director contracts for 2 of our pediatricians. All of those were in order and the board approved the documents. The board discussed updating the advisory services agreement we have with Quorum Health Resources. This was just a conversation. The board made no decision. This will be back on the agenda for the April board meeting. The board had a number of medical staff credentials recommendations. The process works that administration develops a credentialing file. We document the training, the education, the experience of a physician, and then we present that to the medical staff credentials committee. They review all of the information and they make the ultimate recommendation to the board. But the board is the one vested with the authority to actually grant those privileges. So at the meeting yesterday, the board reviewed recommendations from the Credentials Committee and approved all of those recommendations. Continuing with the medical staff updates, I'd like to highlight that March 30 was National Doctors Day. You can't be a hospital without doctors, and in our case, we have a very skilled, a very talented and devoted team of doctors. So we recognized our medical staff, not just the ones that are employed by Holy Cross, but those throughout the community. I think there were more than 70 physicians that we recognized, gave them small gifts of appreciation. And the fun thing, we did a little story using candy bars. We'll put a picture on social media and on our website so that you can see the fun that we had as we recognized and said thank you to our medical staff. We continue our recruitment efforts for a number of new physicians. We're still recruiting for family medicine docs that do obstetrics and pediatrics, and we're also recruiting for a cardiologist. Happy to report that on the leadership front, our offer to a new pharmacy director candidate was accepted, and that gentleman will be starting in April. So good news to have that position filled. We had a special meeting with our medical staff to talk about the family medicine with obstetrics and pediatrics model that I mentioned just a moment ago. And I thought it was important that the community understand our priorities as we move forward with this project. Our traditional OBGYN and nurse midwife model, we don't believe is going to be sustainable. We don't think we're going to be able to recruit OBGYNs moving forward. Most of them are now specializing, subspecializing, and to come to a small community where you're going to be asked to do what I'll call bread and butter obstetrics and gynecologic services. So doctors like that just aren't out there anymore. And we think moving forward that if we don't change our model, we're going to compromise our ability to provide obstetrics and pediatrics. So I want to share with you the goals and objectives that we have laid out that we're wanting to accomplish with this new staffing model in our Women's Health Initiative clinic. So the goals and objectives: we want to maintain the local availability of obstetric and pediatric services at Holy Cross Medical Center. We want to provide these services in a professionally rewarding environment. You have to have doctors that are happy practicing their craft. We need to have stable staffing, and we need to be aware of the trends in rural healthcare. We have to have an appropriate amount of call. If we have these doctors on call too much, they're not going to be happy. So our goal is no more than 1 in 3 call rotation. We need to have good continuity of care between our providers, and it needs to be consistent with external regulatory requirements. The American College of Gynecologists, DNV, Joint Commission, state regulations, all of those our program has to be compliant with. And then it has to be financially sustainable. And we intentionally put money at the end of the list. All of the other things, maintaining the service, doing it in a high quality way that maintains the professionalism of the service, all of those are more important. But if we don't keep money in mind, we will compromise the program. And over time, OB will no longer be allowed here at Holy Cross. So I think it's important that the community understand the conversations that we're having with our medical staff, as well as the plans that we're making to sustain obstetrics and pediatrics here locally. We know that our annual accreditation by DNV is going to happen beginning the 12th of April. This is unusual. It's because of COVID. Normally, these annual inspections are unannounced. This one is going to be both announced and virtual. They're not going to come on site. So we'll have a day and a half of Zoom calls with the inspectors. This is an important step, though, to assure that the services that we're providing are compliant, not only with state regulations, but also with Medicare and Medicaid regulations. We're looking at adding some water tank storage here at Holy Cross. As I'm sure everyone has seen in the news, Texas recently, especially Houston, had problems with water supply when their power was interrupted. We don't want to not have water. So we're looking at creating the capacity to be able to be on our own for 3 or 4 days. We've actually reached out to the Taos Living Center to see whether or not they would want to be part of this project. Since we're right next to each other, it would make sense that they would be supplied by this same tank farm that we're proposing. So we'll keep you updated on that project. This is something that we're doing to make sure that long-term our services aren't interrupted if there's a power or a water breakdown. As part of the tank project, we're doing a complete facility master plan. We're looking at all of our space issues within the hospital, within the clinics that we lease. We're trying to look out into the future, 10, 15, maybe even 20 years into the future. How does the building need to change? And we've prioritized our medical surgical unit and our intensive care unit as the first 2 units that will be studied. So we've put together a team. We're going to actively involve the staff that work in those areas, the medical staff, the doctors that practice in those areas. Even the board is going to be included in this so that we make sure that we have all perspectives. We'll keep you updated. This is going to be a multi-month project, but our building's about 25 years old. It's important for us to be looking into the future to make sure that it can continue to provide high quality health care. The facility master plan will produce a number of projects, many of which will be funded by local tax support, mill levy dollars, GRT dollars. it's important that the community understand that we were anticipating projects like this when we went to the community and said, we need this level of support. So just trying to close the loop to let you see that what we said during the campaign is actually what we're doing now as far as using the dollars. And just to tie it back to that mammo equipment, that is going to be funded with mill levy dollars. There may be an opportunity for Holy Cross to work with the city and county to address substance use disorder issues and behavioral health, mental health issues. This is very early, it's still in the what if stage, but the board yesterday voted that Holy Cross stands ready to be an active participant in these programs. This is still very what if, but it looks as if we may have an opportunity for federal dollars to help fund both operations for these programs as well as brick and mortar if in fact a building is required. Too early to get a lot of details, but I think it's important that the community know these are topics that have been on our community health needs assessment for a number of years. And so we are going to take full advantage of this opportunity to explore if Holy Cross can help play a role to address long-term and permanent solutions to detox and mental health. Two other quick board-related topics. The board has 5 seats that are coming open this year. And so the nominating committee process is in full gear. Just for you that may not know, our nominating committee process is not controlled by the board. We involve the community in a very deliberate way. We have representatives from the town of Taos, the county, Cuesta, Red River. Each of those governments have someone that they've put on the nominating committee. Our medical staff has seats on the nominating committee, and there are a few board members. They are the ones that actually review the applications and make recommendations to the board. And the board almost always accepts the recommendations of the nominating committee. So 5 seats this year that we have to fill. The nominating committee will be busy. And the last thing, people are asking, when are we going to start meeting in person? Well, while we are green, as you know, we went green before and then fell back a little bit. So I think it's probably going to be May at the earliest. We want to make sure that Holy Cross is setting a good example in how we're doing our meetings via social distancing. The board has acclimated to Zoom meetings quite well. So we're going to make sure that the rules allow us to have our meetings where we have 18 to 20 people in the boardroom before we actually take that big step. I hope you found this update useful. As always, please call me if I can provide additional information. Thank you.